I think important qualities for a hospital donation specialist would be being a social type of person, liking to talk to people, liking to educate, and being an effective communicator. Because really everything you do is surrounding you getting your point across, you educating people, managing their expectations, and building relationships. So communication is key.
As a hospital donation specialist, I spend the majority of my time within the level 1 trauma centers. What that looks like is I come in the morning, I review new referrals from the day and night prior, go through what we call timeliness, making sure the referrals are coming in on time. I round with my recovery coordinators, and then I check in with management throughout the day to discuss who we're actively following on their units. If there's not an active case, I focus a lot on education. I educate our clinical triggers. Those are what nurses call on to signify this patient may be an organ donor if they do not start to improve.
Hospital donation specialists are involved in the donor cases from beginning to end. Typically in the beginning, we have conversations with the care team, usually the attending physician, to establish our goal with them, for them to understand what we will be speaking with families about, because they have developed a relationship with these families as well. So we want to keep them informed. During the case, we help facilitate any kind of testing that may need to be done with the donor. We will reach out to those different departments and help in any way we can to get that testing done in a timely manner. The day of OR, we're involved. We usually help with conversations with the care team to make sure they're prepared and they understand the expectations of them for that day. And then at the end of the case is probably where we have the most input. So once the case has resolved, then we need to circle back around and close the loop with all of the members of the care team, all of the different areas of the hospital that have been involved in the donor case, to make sure that things went well from their viewpoint, and if not, how we can improve the next time.
I give presentations to new graduates that are starting out within the hospital systems.
We do education for new nurses, new respiratory therapists, any bedside staff that's going to be dealing with donations. So we educate them usually at their orientation process. We continue educating every day. Every day is something new that is happening in donation, or something new that maybe we changed our process a little bit to where they need to understand why we're doing things, because it's not always traditional in their sense, like hospital sense of providing care for a patient. Sometimes what we're asking them to do is a little different, maybe for different reasons, and they need to understand why we're asking that and what our purpose is.
I send letters to administration every month within our hospitals, and this is to keep them updated and informed of what we've been doing within their hospitals, their number of referrals, timeliness, and just keeping that open relationship between us and them. I'm very much into the implementation of hospital and CMS policies, and I go through data to make sure that those policies are being followed and patients are being called in appropriately, and that they can be evaluated for organ tissue and eye donation when the timing is appropriate. I also have meetings with hospital administration. I complete donor council. This is again with hospital administration and management, where we go through hospital data, where are there needs for improvements, what are we doing well in, and it's all about collaboration.
One of my most favorite parts of my job would be to circle back with the care teams, the nursing staff, after the case is over, to let them know what good was able to come out of this case, how many lives were saved, and to make sure they are aware this process couldn't happen without them.